Today we will discuss about the prescription. What is prescription and what is the role of pharmacist in a prescription? Prescription is a written order form of a registered medical practitioner or other proprietary licensed practitioner such as dentist or veterinarian. The order is accomplished by the direction for the pharmacist to prepare a specific type and quantity of preparation of the patient, and the prescription also includes the direction from the patient regarding the mode of administration of drug which is dispensed to him. Now the parts of the prescription. There are various parts of the prescription such as date, name, age and sex and address of the patient, superscription, inscription, subscription, signature, renewable instructions, and signature, address and registration number of the prescriber. The signature, address and registration number of the prescriber may be heading of the prescription. As you see in the diagram, first part is the doctor name and his registration number and address of the hospital or address of his clinic. This is the identification mark, the who write the dispensing, who write the prescription. The first part is the date of prescription. Date of prescription is a date in which the prescription is written by a physician after the inspection or any other diagnosis is required. Second part is the name, age and sex and address of the patient. This is a very important information about the patient. You know about the sex of patient, the patient is male or female, and age, what the patient is children or an adult. So it helps pharmacist to in the dose calculation. Third part is the superscription. Superscription is the part, it is denoted by a symbol RX. It is a Latin term and it means you take. In olden days the symbol was considered to be originated from the sign of Jupiter, god of healing. It means you take that medicine and you be healed. Next part is the inscription. Inscriptions are the part, this is the main part of the prescription order, contain the name and quantity of the prescribed medicines or ingredient. The name of each ingredient is written on a separate line along with its quantity. It is divided into three parts: base, adjuvant and vehicle. Next is the superscription. Superscription comprises direction to the pharmacist for preparing the prescription and number of doses to be dispensed. As you see in the diagram, that is the frequency and duration that help in the calculation of total doses. If you take 2 times a day, then quantity required and the duration is 2 days, then 4 doses required. If you take it will 3 times a day and for 5 days, then it will take 15 doses. That is the superscription. Next is the signature. This consists of the direction to the given to the patient regarding the administration of drug. It is usually written as signature on the prescription. The instruction given in the prescriptions are required to be transferred to the label of the container in which the medication is to be dispensed so that the patient can follow it. The quantity of taken, frequency of administration or application, the mode of application. It means you take in water or with milk or any other things, or it is in the form of tablet that you should take it water, or it may be the syrup you should take with a sip or hot water or cold water. Next is the renewable instructions. Renewable instructions are the it means it is in the diagram you see the next review date, that is the renewable instruction. That this is the instruction for the pharmacist, that the pharmacist renew its or redispense the same medicine with the same prescription how many times. It means only you have to take 1 times or 2 times renew it. This is the most important in the role of when the drugs is sedation type or any narcotic type drugs or habit forming drugs. The renewable instructions should be applied. Next is the signature, address and registration of the prescriber. And in the last you see the signature and seal call stamp. The physicians or that doctor or a medical practitioner should sign and stamp the prescription to complete the authenticity of that. That's it. Thank you.